Did you know that in the United States, approximately 6.5 million people suffer from chronic wounds? Proper wound care can reduce healing time by up to 50%. Hello everyone, I'm Lara Favario. I'm a nurse in France and I'm medical education manager for Smith+Nephew. Welcome to this Smith+Nephew presentation on wound dressings. In this short video, we're going to take a look at how to choose the right dressing for the right wound. Today, we'll cover three main points. First of all, different types of wound dressings. Then, general steps for applying wound dressings. And then, a decision tree to help you choose the right dressing. Let's get started. Dressing overview. There are various types of wound dressings available, each serving a different purpose based on the wound's needs. Here are a few common ones. Gauze dressings. These are versatile, cost-effective, and commonly used for absorbing exudates. They can be used as primary or secondary dressings and are suitable for packing wounds. Foam dressings. Ideal for wounds with moderate to heavy exudates, foam dressings are highly absorbent and provide cushioning, making them suitable for pressure ulcers and other wounds needing extra protection. Hydrocolloid dressings. Best for dry wounds are those with minimal to moderate exudates. Hydrocolloids create moist environments by forming a gel when in contact with wound exudates, promoting autolytic debridement. These dressings are particularly useful for necrotic wounds and shallow wounds with minimal drainage. Hydrogel dressings. These are primarily used to add moisture to dry or necrotic wounds, assisting in autolytic debridement. Hydrogels are water-based and soothing, which makes them ideal for wounds with exposed nerve endings. Unlike hydrocolloids, hydrogel do not form gel in response to exudates, but rather help to rehydrate dry tissue and reduce pain. Alginate dressings. Derived from seaweed, these are great for wounds with significant exudate and can also help control minor bleeding, making them suitable for surgical wounds and trauma injuries. Antimicrobial dressings. Used to reduce the risk of infection. These dressings are often impregnated with silver, iodine, or honey, which have broad-spectrum antimicrobial properties. And last but not least, negative pressure wound therapy. Negative pressure wound therapy involves the application of a controlled vacuum to a wound through a sealed dressing. This therapy promotes wound healing by drawing out excess fluid, reducing edema, and increasing blood flow to the wound area. Negative pressure wound therapy is particularly effective for large, complex, or chronic wounds, including deep pressure ulcers, surgical wounds, and wounds with significant exudates. It can also help with wound contraction and the formation of granulation tissue. When selecting a dressing, consider factors such as moisture balance, risk of infection, and the wound's location. Additionally, think about patient comfort and the frequency of dressing changes required. Let's now talk about the general steps for applying wound dressings. Here are 6 key steps you should always follow. First one is assessing the wound. Examine the wound to determine its size, depth, type, and exudate level. Assess the wound bed and the surrounding skin. Then you must cleanse the wound. Gently cleanse with a suitable wound cleaner or saline solution to remove debris and reduce the risk of infection. Then comes debridement. This is a crucial step to remove dead or non-viable tissue that can hinder the healing process. Make sure any debridement is done by a qualified practitioner. Apply the dressing. Choose the appropriate dressing based on the wound assessment and apply it carefully, ensuring it covers the wound bed adequately without overlapping excessively into the healthy skin. Then you need to secure the dressing. Ensure the dressing is secured with adhesive tape, film, or secondary dressing to keep it in place and prevent contamination. And last of all, you need to monitor and change the dressing. Regularly check the wound for signs of infection, exudate levels, or healing progress. Change the dressing as needed, following clinical guidelines and manufacturer recommendations. To help you decide which dressing to use, let's walk through a simple decision tree based on the time framework. T for tissue. Identify the barriers to wound healing and analyze the type of tissue in the wound bed. If you have slough or necrotic tissue, you need to consider autolytic debridement. Hydrogel or hydrocolloid dressings are suitable for this condition. If you see granulating tissue, make sure you protect it with a non-adherent dressing layer first. Then, with I for infection and/or inflammation, the barriers to wound healing could be an infected tissue or a suspected biofilm. Here, the objective is to manage bioburden. For that, antimicrobial dressings like silver or medical honey are beneficial in managing infecting wounds. With M for moisture balance, we are talking about a dry wound or a wound with exudates. You need to assess the level of exudate of the wound. In that case, you need to restore moisture balance. For dry wounds, hydrocolloid or hydrogel dressings help maintain a moist environment, which is crucial for wound healing. For heavily exuding wounds, foam or alginate dressings are ideal, as they absorb excess moisture and help prevent maceration of the surrounding skin. As we have seen earlier, negative pressure wound therapy could be also used here, as it helps to manage excessive moisture by removing fluid from the wound. Finally, E for edge of wound. You need to evaluate the wound edge to determine if the edge of the wound is either non-advancing or abnormal. The objective is to promote epithelialization and the health of the peri-wound skin. Foam dressing protects the wound edge, and negative pressure wound therapy promotes granulation tissue formation and reduces edema. By following this decision tree, you can select the most appropriate dressing that addresses the specific needs of the wound and support optimal healing. This wraps up our Smith+Nephew presentation on how to choose the right dressing for the right wound. Today, we looked at different types of wound dressings, general steps for applying wound dressings, and a decision tree to help you choose the right dressing. I hope this will guide you in creating better outcome and a better quality of life for your patients. Make sure to check out our other titles at Smith+Nephew Academy online. Thanks for watching.